pleased to introduce the moderator of our first panel, Dr. Catherine Simpson, who has completed a PhD at Concordia that focused on race, gender, and subjectivity. Dr. Simpson is also active with Gay and Grey Montreal, offering her services to help grow and diversify our membership. Dr. Simpson.
Hello, everyone. I'm delighted to be here with you all. Thank you so much for attending, both panelists and audience members. I'm thrilled to introduce our panel one presenters, all of whom have done really important work in the area of 2SLGBTQIA plus senior housing and care. So our first presenters for today are Dr. Ailsa Craig and Dr. Sulaimon Giwa, and I'm just going to give a really short introduction to both of these scholars. So Dr. Ailsa Craig is a professor of sociology and also the interim dean of the Faculty of Humanities and Social Sciences at Memorial University in St. John's, Newfoundland. With expertise in structural inequality, gender and sexual diversity, community and cultural sociology, Dr. Craig also serves on the Premier's Roundtable on Gender Equity. Dr. Craig co-founded Quadrangle NL, a community center for 2SLGBTQIA plus individuals and organizations in Newfoundland. And they were also a founding consultant for the International Lesbian and Gay, Bisexual, Trans Artist Residency. Dr. Sulaimon Giwa is an assistant professor and associate dean at Memorial University, working in the School of Social Work with a cross appointment to the Department of Sociology. Dr. Giwa is also the endowed chair in criminology and criminal justice at St. Thomas University in Fredericton. Dr. Giwa's work is interdisciplinary, with primary research interests in critical race theories and praxis, intersectional forces that shape the correctional and policing experiences of racialized and underserved communities, as well as intersectional considerations of 2SLGBTQIA plus issues. So welcome, Dr. Craig and Dr. Giwa. Thank you so much. Oh, and one last note, pardon me, sorry. Just to let you know that it'll be our tech genius, Riley, who's going to let you know when you have 5 minutes left for your presentation. Thanks so much.
Excellent. Thanks so much for that kind introduction, Kat. I'm going to try and share my screen for our slides here. Can everybody hear me okay?
Mm-hmm. I can.
Okay, great. And I'm sorry, share screen. Can somebody walk me through that? It's different than...
You should have a button at the bottom, no? The green in the center.
Oh yes, the one that's bright green. Understood. Yeah. My apologies.
Not at all.
Is that visible for everybody?
Yes.
Excellent. Again, I just want to say it's a real pleasure and it's an honor to be here with everyone today and to have this opportunity for this conversation. Dr. Giwa and I are presenting research that we've done on Newfoundland LGBTQI2S seniors in relation to their housing and care as they age. And we came to do this work as two academics who sit on the board for Quadrangle NL, which is a charitable organization that Kat mentioned that's working towards building a community center for the province. Grey Gaze NL, which is a local group here in St. John's, received funding from the City of St. John's, their nonprofit Housing Catalyst Fund, and they approached Quad to ask if we could assist with a study to help them provide data that's specific to Newfoundland that could be used for advocacy within the province. So in addition to thanking our funders, Dr. Giwa and I are grateful for the work of our collaborators, Amanda Page Warren and Brittany Burns. We also want to thank the research participants for their time and contributions to the study and acknowledge the generous support of the groups and organizations who promoted the study on their websites and social media platforms. And just let you know that the full report is available at the Quadrangle website, which is just www.thequadnl.com. So Research by Gahagan, I see Jackie is here today, which is lovely. Colpitts, Redden, and the National LGBT Housing Matters Research Team have provided significant analysis of the experiences of older LGBTQS adults. But Newfoundland is a province where this kind of research has been lacking. Most research has largely looked outside of Newfoundland and Labrador for participants. And when they have been included, for example, in Gahagan's 2020 study, any specificity of that experience can be lost in the larger themes of the data. So, for example, fewer than 19 Newfoundland and Labrador survey respondents out of a sample of 711. So it's very easy to get lost in the mix. A really brief overview of the current literature shows that there are 2SLGBTQ older adult concerns about access to safe and affordable housing, a need to include their perspectives in planning and policy, and there are also issues related to social isolation that affect all older adults, but can have particular experiences for those of us who are LGBTQ2S. Our research supports these findings, but also has more to add. As in other areas, conclusions drawn from studies done in the mainland can't be assumed to apply to Newfoundland and Labrador. The capital of St. John's is the only city in Newfoundland and Labrador that's large enough to be categorized as a large urban center. And even so, it barely passes the mark with a population of 108,860. That was in 2016, so who knows, that could be up or down by 10, 15, 20. It's fairly small numbers for our largest city, but it's still a capital. And being a capital does mean certain things in terms of the ways you act as a center for the province, of course. The study that we did was therefore important for two reasons. One was to provide local organizations with data specific to Newfoundland and Labrador. And two, we wanted to add to research on this population more generally and provide analysis of what might be specific to Newfoundland and Labrador, both to advance understandings of the dynamics within this province and to provide discussion points that might help us with understanding other experiences for people who are rural and remote and living their 2S LGBTQ lives. I'm going to turn it over to Sulaimon next. He's going to talk about theoretical frameworks.
Thank you so much, Dr. Craig, and good morning to everyone. So our study adopted a life course and intersectionality perspectives, and the current cohort of sexual and gender minority, which I'm calling them because I find 2SLGBTQIA+ mouthful, older adults in Newfoundland and Labrador are unique in their historic experiences of being the first generation that were liberated in and through the LGBTQ rights movement of the 1960s and 1970s. So the life course perspective does kind of recognize the role of historical, social, individual events, and also environmental factors in shaping human development and experiences over time. While the theory also emphasizes that human beings are interdependent, it recognizes as well their agency to make individual and collective choices within context of opportunities and also structural constraints. Intersectionality, however, is also useful for showing how different social categories intersects to create interlocking forms of oppression and privilege. The interconnections between these identities are central to recognizing the types of experiences that sexual and gender minority older adults face in their daily lives, both in terms of the sequence of significant events and life transitions, and also how patterns of individual lives are influenced by culture and social institutions. We found that employing intersectional and life course perspective in our study allowed for a comprehension of health and well-being that is multidimensional in its ability to incorporate the influence of social identities. Next slide, please. Thank you. The research question we sought to answer with our study was, what are the specific challenges faced by LGBTQI2S+ older adults in accessing and planning for senior care and housing in Newfoundland and Labrador? Our study data were collected between March 5 and 26 of 2021, after the study had received ethics approval from Memorial University. We used qualitative survey and semi-structured in-depth interviews to collect data from sexual and gender minority older adults. We had a sample size of 29 sexual and gender minority older adults across Newfoundland and Labrador. Notably though, 16 out of the 29 participants were between 60 and 79 years of age and made up the majority of our sample size. The most commonly stated sexual orientation was gay. 13 out of 29 participants identified in this way. In terms of race and ethnicity, 27 participants identified as being white, And this also comprised the largest group in the study. In addition, 12 out of 29 participants said they had biological or adopted children, and the majority reported an average annual income between $20,000 and $34,999. We also developed an administered survey instrument to collect data from long-term care home service providers. Although we reached out to all 37 long-term care homes in Newfoundland and Labrador, we secured only 4 responses. Admittedly, in both cases, our study yielded a small sample size because of the time constraint that was imposed by the funder. This is a limitation of the study for sure, but it's also possible that with more time, we would have been able to recruit more participants into the study. Next slide, please. All long-term care home providers who completed the survey stated they were somewhat knowledgeable about sexual and gender minority issues. They responded similarly to their perception of staff knowledge around sexual and gender minority issues. Additional findings from the survey were that 75% didn't know or believe LGBTQI2S+ older adults have different needs compared to their heterosexual counterparts. 100% also reported no current services or programs for LGBTQI2S+ older adults within their facilities. 100% also said no LGBTQI2S+ professional development training are being implemented for staff within their facilities. 100% also noted facilities allowed cohabitation among LGBTQI2S+, similar to the same policy that is in place for heterosexual counterparts, which is a positive note from our study. 75% were not aware of any LGBTQI2S+ older adults in their care. And this is despite the fact that 100% of them also indicated earlier that they had somewhat knowledge about LGBTQI+ issues. 100% also reported facilities had not undergone any inclusive diversity reviews. And 100% also said that they would like training about LGBTQI2S+ older adults, while 75% preferred online training as the mode for delivery for this particular training. I will now yield the floor to my colleague, Dr. Craig, to review the next several slides.
Great.
I had to do it at least once, didn't I? I was I'm so sorry. I hope that I did that for all of us, for the entire
You did.
panel.
You did. You saved us all from doing it later. Thank you, Ailsa.
Yes, maybe. Let's hope so. I'm going to talk a bit about the findings and analysis from the survey and interviews that we did with individuals. So we had 5 main themes that emerged from the data, and I don't think that any of these are going to be a surprise to anyone. So we had desire for community, loneliness and isolation, issues around bias-free housing and care, fear of discrimination, financial concerns, and insecurity. And there's a lot of overlap in these themes. And themes 1 and 2, which are desire for community and loneliness and isolation, are clearly 2 different sides of the same coin, as are themes 3 and 4. But while these themes resonate with those that we found in our review of the literature, it's through the refinement of these emergent themes that our analysis points to the particularities and specificities of the Newfoundland and Labrador context that can helpfully inform recommendations that are appropriately attentive to how the context of living in Newfoundland and Labrador intersects with the experiences of older LGBTQI2S folks and aging. And that's what I'm going to focus on here. So the specific desire for LGBTIQ2S community and feelings of loneliness and isolation may be highlighted for Newfoundland and Labrador older adults over others who research in other parts of the country that have larger populations and urban centers. The reason for that is that, of course, that higher populations and larger urban centers can increase the likelihood of there being gay neighborhoods. And there's a lot of research on the importance of those neighborhoods. And the number of LGBTQI2S community members present in larger urban centers is due both to the draw that cities have, the kind of gay imaginary that Kath Weston talks about, and to the fact that the larger a population is overall, the greater number of LGBTQ2S folks are likely to be present. So this also often means that there are more businesses, there are more clubs or organizations that exist specifically to serve our population. So as one survey respondent lamented, we need more social groups and or support, while another noted there are risks that connected those to a lack of community support in the province. And they said loneliness and lack of community support advances bad sexual relationships and mental health issues. In fact, Newfoundland and Labrador is one of only 3 provinces in the country that doesn't have a brick and mortar community center that's focused on LGBTQIA community members and organizations. And most social spaces that we have are through events or occasions, either public or private, and they don't provide any sort of consistent social space. As one queer female in her 50s shared, it seems the community is invisible. There needs to be something to bring people together. And another thing around the discussion of loneliness, that it revealed that there are cultural divides that are specific to Newfoundland and Labrador, as seen in comments from one survey respondent who noted, "I am a come from away and I have lived here for many decades, but I still feel like an outsider to the dominant population." And that's a cisgender. Pardon me?
Is that Mama Shark?
Oh, Mama Shark is cisgender lesbian who's between the ages of 60 and 69. And that sense of being an outsider in Newfoundland and Labrador can intersect with the isolation that's connected more specifically to 2SLGBTQIA.
Mama Shark.
Both generally and in Newfoundland and Labrador, with its smaller population and fewer community spaces. Another participant, whoa, I jumped.
Going so nicely.
Another participant noted, "I'm not sure how much of a community there is here of people that are getting older, you know? As LGBTQ2S, you know, we say it's a community, but what does community mean? You know, for me, it means people checking up on one another, calling each other when you can, going to visit once in a while, inviting you places, but I don't see that happening a lot. So yeah, it is isolating." The experienced divide between come from away, so people who aren't originally from Newfoundland and Labrador, and Newfoundlanders has another divide as a counterpart, and that divide is that divide, and I've gone back again. I'm sorry.
That's okay. You still have time.
Well, that's good. I was trying to see what I could do. I would like, how do I go back again? There we are. The difference between townie and bayman is another divide that's a counterpart, where a townie is somebody who lives in St. John's, and a bayman is somebody who lives beyond the overpass, is another way that people sometimes talk about it, people who are from some of the smaller rural and remote communities. So there is a commonly expressed disdain from both sides and a resistance on the side of those outside of town, outside St. John's, to have to go to town to access similar services. So that's one of the dynamics that sometimes comes up. And not only did respondents feel disconnected from local communities, but the data also revealed a lack of certainty in how family might be able to help. And this is consistent with other research that our sample were not as likely to have children, but there were 2 interview respondents who indicated that even though they had children, there was something specific about being Newfoundland that being in Newfoundland and Labrador that made them feel less likely to be able to rely on their kids for support as they age. As one respondent said, "I can't rely on my child to assist. If he's here, he would, but I don't expect he'll stay in Newfoundland. Once he gets an education and figures out what he wants to do in his life, he's already said, Mom, there's nothing here for me anyway. There's no work, right? He said, I could struggle or I can go away and try to make some real money." And I said, yeah, those are your options, right? So when he gets his accreditation, he's gone. So in my old age, unless I have a life partner or partners, because I'm polyamorous, but you know, it's just going to be little old me. Been like that most of my life anyways. And that comes from an interview with a queer trans woman in her 50s. So I'm going to move on now to talk a little bit about the recommendations that we have coming out of the study. And our recommendations fall under 2 main themes, both addressing and supporting community connection and the availability and provision of non-discriminatory and or affirmative care and housing. So on the left, the first one, that we include creating and supporting LGBTQI2S plus social events, gatherings, and meeting spaces that focus on bringing older adults together. The second recommendation is creating and supporting community-built infrastructures for cross-generational care and companionship. So circles of care, cross-generational queer community opportunities for mutual benefit and companionship. The third recommendation there is increased employment opportunities for LGBTQI2S community members in long-term care facilities. And that's because the study highlights that fear of discrimination, isolation, and stigma impacting older adults when planning for long-term care in Newfoundland and Labrador, and having community members on staff has been identified as a factor that can increase positive experiences. Our fourth recommendation is that in collaboration with community, that there be services implemented, services and programs implemented in long-term care facilities to meet the needs of LGBTQI2S plus older adults, and that this should be in every long-term care home in Newfoundland and Labrador, not just in town. And that's something that really came out clearly in the data. The fifth is that LGBTQI2S older adults living in long-term care homes should have increased access to support from the community. And that could mean trying to figure out ways to take some of what we've learned during COVID to make virtual spaces, to make those spaces more accessible for people who are spread further afield in rural and remote communities. And also, shared rooms for partners in long-term care homes is also one of the recommendations, which, as Dr. Giwa pointed out, so far so good, it seems, from some of the data that we've corrected. Moving to the right side in terms of availability and provision of affirmative care and housing, as Simpson, Almec, and Wathery have shown in their 2018 study, providing the same care for all residents, regardless of their sexual orientation or gender identity, can actually reinforce heterocentric norms that deny sexual and identity difference. And this can affirm the fears of older adults that their lives and identities will be erased with the transition into long-term care homes. So these suggestions are include recommendations that make existing care and housing safer or more welcoming and aware. So the first is mandatory training for all doctors, nurses, home healthcare support workers, and staff at long-term care facilities province-wide. The second one is funding or subsidy for home care, housing, and long-term care that's attentive to or targeted for LGBTQI2S plus seniors. The third is community supports for affirmative housing. And this can include supports for a wide range of different things. So cross-generational supportive living arrangements among community members for creating that kind of collaborative circle of care that I mentioned earlier. And the fourth one is an annual diversity and inclusivity reviews of all long-term care facilities in Newfoundland and Labrador to sort of assess where people are, give them a way of better understanding how well they're doing. I'm going to turn this now back over to Dr. Giwa, and you'll all be pleased that you don't have to deal with my technological incompetency any longer.
Thank you very much. In summary, then, findings from our study support and add to existing research. On one hand, sexual and gender minority older adults in Newfoundland and Labrador have shared commonalities with those in other parts of the country. But despite these shared commonalities, there are area-specific concerns related to community, social isolation, discrimination, which require sustained policy and practice consideration. And finally, the professional development needs of long-term care homes providers cannot go unaddressed if we are to ensure optimal service delivery to sexual and gender minority older adults across the province. Thank you.